Okay. So hello, everybody. How are you?
Thank you.
Kind of already said salam to everyone. And so today the topic is prescriptions because it is July and it is officially Prescription Awareness Month. And so we decided to have this topic today. And since I have the pharmacy background, we're like, okay, why not? Let Sophia do it. Okay, so what I wanted to touch on today is number one, obviously, what is a prescription? Most of us know what that is, but we'll go into a little bit more detail so that you guys know exactly what's written on a prescription when it's given to you by a doctor. And I also wanted to go over a couple of statistics and some of the most common medications that are used in the more senior population. And then also we're going to do a little bit of interaction in between the sessions, so be ready for that. However, for now, if you guys can please put yourselves on mute, just in case if there's any background noise. And then in the last couple of minutes segment, we will go ahead and take questions as well. So if you have any questions, you can write them down so you don't forget as we go through the session. All right, so just a little bit of, I'm just gonna do, it's a little bit of housekeeping right now. Okay, all right, so, what we're gonna do is we're gonna start off. Okay, so just a raise of hands. How many of you, and if you guys are comfortable taking yourselves off and put yourselves on video, that would be great. Or if you are not comfortable, then if you can raise your hands when I ask you to raise your hands by using the reactions, which is at the very bottom of the Zoom bar, and then you can raise your hand, you can lower your hand whenever needed. So how many of you have ever been on a prescription medication? Please raise your hand. All right, so I can see 2, and I can't see the other 2, so I'm gonna assume, I'm just gonna go by the people who have their videos on. So 2 out of 2. Okay, so how many of you are taking a prescription on a regular monthly basis? You can raise your hand. Okay, got it. And how many of you are taking 2 or more prescriptions on a regular basis? Okay, how about 5 or more? 5 or more. Okay, so it seems like it's less than 5. Okay, all right, great. So yeah, so all of us are pretty familiar what a prescription is. And there is a statistic that I pulled out from the CDC website, and it says that about 69% of Americans are on at least 1 prescription, and about 1 out of 5 Americans are on 5 or more medications a month. And that is, you know, when you're on multiple medications, it then a set number of multiple prescriptions is considered polypharmacy. So that's also something that's you know, you want to be aware of, because then drug interactions might play a role with multiple medications. So what I want to talk about is going back to the very basic is, what is a prescription? So a prescription is a physician order, and it's like either a preparation of administration of a drug or a device that the physician then gives you a little paper that kind of looks like this, but it's not green, it's white. And then you take it to the pharmacy. These days, doctors might even send it electronically. They can, you know, ask you, where is your pharmacy? Where would you like your prescription to be filled? Then they directly will electronically send it to your pharmacy. And so once you get to the pharmacy, you will go to the drop-off window. Let's just say for conversation's sake, you have a paper prescription, and then you go to the pharmacy and then you hand it to the pharmacy staff, technician, pharmacist, whoever, and they'll take your prescription and then they'll look at it, and there's certain things by law that have to be written on the prescription, and it might vary state to state because every state has their own laws. However, there's some information that needs to be there for sure, and that would include your name, your address, date of birth, doctor's name, address, their DEA number. Then the prescription also has to have the name of the medication, the dosage strength, the directions, the quantity, and it also might have a space. It does have a space called number of refills, and it might have multiple refills on it, or it could just be a one-time. So there, it might say 0 on it. So that's usually what's on the prescription. And so that's what you give to the pharmacy staff, and then they'll say, okay, we'll run this through your insurance, and then you can pick up the prescription maybe in 20 minutes or in a day or two, whenever you want to get it. Once you go, this whole process is done in the back of the pharmacy. You go pick up your prescription, and you will see you might have to pay a certain amount of money, and sometimes it's 0, and it can be all the way up to thousands of dollars if it's not covered by insurance. I work at a CVS pharmacy right now, and I've seen the difference that people have to pay for their medication, and it really blows my mind how some people might have to pay $0 versus other people who might have to pay in the hundreds just based on their insurance, but it's the exact same medication. And it's a very complicated process how they come up with this number. Even I don't understand it myself. It's just very complicated. And so anyways, so that is basically the process. And what I wanted to discuss with you are, since we are on the topic of money for prescriptions, a couple of ways that you might be able to reduce the cost of the medications. Do any of you pay in the $1 to $100 per month for medications? Can you raise your hands in that range? Anybody higher than that? No? Okay. Okay, that's good to see. Okay, so basically, if you have good insurance, and good insurance obviously has means that does your insurance, what insurance do, they have a list of medications that are on something called a formulary. So basically they have a formulary, which is a name of saying they have 1,000, whatever number of drugs that they have a list of, which if you get prescribed one of those drugs, then you pay a lower price than the list price that the manufacturer would charge you. And then some magical way they come up with this number that you have to, pay, or it's even maybe $0 if it's covered by insurance. So if you ever get a prescription and it's very expensive, number one, you can ask the doctor if there is a generic available for it. And a lot of times, well, the generic brand is definitely cheaper than the brand. Sometimes, however, it might not be advisable to go from a brand to a generic, or a specific company that you're using to another company. And that usually is with medications that are very low dose, like thyroid medication. It's in the microgram range. So switching companies or brands for that sort of medication might be a little bit more tricky. So, but for other medications, you can definitely ask if there is a generic brand. Number two, what you can do is you can ask the doctor if there are any coupons from the company, or you can go to the website for these companies and you can see if they have any rebates that are available. Another thing you can do is ask your doctor if they have any samples in their office. sometimes when doctors have samples, they'll give you a 30-day supply. They can even give you up to a 3-month supply. And I've seen this done as well when I worked in a clinic. We would always give our patients cholesterol in the cholesterol clinic. We would always give them like Lipitor for free. And they would, use it and come back. And next time they came back, and then if they needed more and they couldn't afford it, we would just give them the samples. So that's another way. And then the third way is there are different websites on the internet that you can go to. One of them that I know of that has good rebates or good coupons is goodrx.com. Have any of you ever heard of that one? Goodrx.com. Okay, so this is something maybe that you might want to write down, or just keep in the back of your head if there is somebody, and not specifically for you, but you can even tell your friends and family about this if they have, medications are expensive. They can go over here and see, they can put in their medication name and dose, and they can see if there's a coupon, and then the pharmacy can apply that coupon, and the medication price will go down. So those are things when it comes to the money part of medications. I actually wrote down a couple of medications that while I was working over there, and it's really crazy to see the list price and then how much a person pays. There was a 30-day supply of estrogen patches. 30-day supply is $424 if you don't have any insurance. And the specific person who came by, due to their insurance, they pay $45 a month. And so significant difference with insurance. There's one medication, I won't say the name because it's very, very complicated, but it costs per month, it costs $3,635 a month. And let's just put that into perspective. Okay, if we have 3,635 times 12, that's a year's supply. That would be $43,620 per year. Per year. Who can afford that? So that's the list price. That's the price that the company is, selling it for. Thankfully, this patient came in and they had to pay $0 because they had really good insurance. But it's so unfair, right? What if somebody needs it, and what are they going to do if they can't get it? Anyway, that's a whole other conversation we can have. But today we'll just kind of stick to medications and some tips and some awareness about things about medications. Any questions so far? Okay. Such as Sophia?
I was just wondering, how did they come up with those prices? Because, I mean, some medications are very, very inexpensive, and then they come up with these huge prices. I mean, is it the way they're made, or where they get them from, or how do they come up with that?
I did a little bit of research for today, because in pharmacy school, I never really focused on that because that's more management. However, what I realized is such a complicated process and how they come up with this price. I don't know. And this year, in January 2021, they increased the list price of thousands of medications by 1 to 5%. So I don't know if you've noticed, but I've noticed being at the pharmacy, a lot of patients' copays went up too.
Mm-hmm.
And I don't even know what the reason is, how it can go up. But the part that's the worst is that the person who suffers is the customer, the patient.
Right.
Because it all comes down to them taking it, taking the grunt of it. So that question I cannot really answer, because there is the drug company. The drug company then talks to this, it's called a PBM, the Pharmacy Benefits Manager. That's the company that works with the drug company, and then they work with the insurance company, and then it trickles down to the patient. But then when the billing happens, it's a weird loop. It's not very easy to understand. So I honestly couldn't explain it. If we would have to get somebody who works at a PBM to explain that one. But yeah, totally. And I don't understand how it can just go up, or even like insulin.
Right.
You know, insulin has gone up as well, and and that's been a huge talk as well. Okay, so let's put that aside now, and let's talk about a little bit of the common medications that the 10 most common medications that are used in the elderly population. And when I say that, it's like about 50 plus, 55 plus. And it actually, a lot of them are also used in the 40 plus adults. So number one, hydrocodone. Any of you heard of hydrocodone? Okay, yeah, so that's a pain medication. That's pretty up there in the medications that are used. Number two is simvastatin, which is a cholesterol medication. And number three is lisinopril, which is for blood pressure. Levothyroxine for the thyroid. Amlodipine is for the heart and blood pressure. Then there's omeprazole, Prilosec. It's an antacid. It's not an antacid, but it's used for stomach acid conditions. And then there's azithromycin, which is a antibiotic. Metformin, which is for diabetes. And then hydrochlorothiazide, another blood pressure medication. Do any of these sound familiar to you guys? Okay. All right. Do you guys, so let's go ahead and I just want to pause for a second. And then what I want you guys to do is, if it's convenient for you guys, if you can go to your medicine cabinet and maybe grab your medication and bring it back to where you are right now, because I want you to like physically take a look at your bottle and kind of see what is on there. So if we do it, then it'll stay with you longer, it'll retain. So go ahead and if you have a medication bottle or a box, go ahead and grab that if it's convenient. I'll give a couple minutes. Shamim, Nisha, you guys want to come off video? Okay. Okay. So looks like Sister Sophia and Sister Rabia are back. I don't know about the others. I'm going to assume they are. Okay, so go ahead and take a look at your bottle if you have a bottle over there. So do you see your name, the name of the medication, the strength of the medication, the directions? The number of refills?
Yes.
Yes, good, perfect. So these are the things that just be aware of these things, because you know, we should be an active part of our health. And so just by knowing what, you know, strength you're taking and the indication how you're taking it, it's very important, because what if the, you know, doctor or the pharmacist or pharmacy messes up, right? Just for some reason. And, you know, everybody's human. There can be errors that, and they happen all the time. And also you should take a look at what your pill looks like. because there are medication errors that happen. So just be aware of these things with your medication so that, you know, like, oh, okay, I take, you know, 200 milligrams of metformin, or I take, and for what if you got a 400 milligram tablet? So just having those things, keeping that in mind. And I've seen it myself, where the pharmacy dispensed an antibiotic instead of a pain medication. And, you know, thankfully the customer came back because they got to their car and then, you know, and they realized it, but that could have been huge if they took that.
Yeah.
And even like when I worked in the hospital, a lot of times there were, and, you know, it happens, medication errors, and then they have to like, we have to document and, you know, put those things down. So being an active part of your health is taking care of your medications, knowing what you're taking, what your medications look like. And if you're getting to 1 refill left or 0 refills left and you only have 15-day supply left, then be sure that you call your pharmacy or you call your physician to reorder, renew your prescription. A lot of times pharmacies now do it for you, but if you're not enrolled in that service, do, you know, be sure that you take care of these things a week or two before you run out of your medication. Because if it's something that you've got to be on, like blood pressure or diabetes medication, you don't want that, you know, you don't want to fall off and not take that medication. It's very important to keep it going and keep your medication. And then, you know, pharmacies might not be able to fill it too far in advance because of insurance and coverage. So you got to keep that in mind too. Another thing I wanted to talk about, I know we went into detail, not detail, but we went over the number, the top 10 medications that are used. So when we take a medication, we go to the doctor's office, you know, we meet with the, you know, we're having something going on, we go to the doctor, and then we tell the doctor within less than probably 10 minutes what's going on with us for, you know, for maybe a month or weeks. And then within that 10 minutes, the doctor has to kind of figure out what's going on with you. So they might prescribe medication, they might order lab tests, scans, whatever. And so they might give you a medication, and or they might wait until your lab tests come back or your scans come back and then prescribe a medication. So once they say, you know, they diagnose you, because they have to give you a diagnosis so they can put it into the coding system so they can then, you know, insurance can kick in and all that kind of stuff. So you have to be categorized. And then based on that category, they prescribe medication. And so in order to be an active part of that process, you should have a list of questions ready for your doctor when you go into the office. Like, okay, I'm starting this medication. What is this for? Obviously, they will tell you. What are the common side effects of this medication? How should I be taking this? And most of the time doctors will tell you, but it's always good to have these set number of questions ready in case they're, you know, didn't tell you or forgot to tell you, or might be in a hurry. They might not have told you. And then it's very hard to get in touch with the doctor again once you leave that office. So ask about the common side effects, how you should be taking it, especially with diabetes medication. Is it in the morning? Is it in the night? Blood pressure medication, any kind of medication, ask. And what if the side effect happens? What should I take? A lot of pain medications cause constipation. So you should have it with a lot of water. You should have a lot of fiber, and you should probably maybe even have to take a stool softener while you're on that pain medication. So there are things that might not be, you know, you might not know, okay, this side effect happens, but what do you do, right? What can help you? So ask all these questions, even ask like, you know, is there possibly a generic in case this medication might, you know, the brand might be too expensive? Have that answer within your, you know, so that maybe later, if it is expensive, you can just say, oh, can I get the generic? Also ask them, how long do I have to be on this medication? Is this a lifelong medication? Or if I take care of my health from my side, Is there a possibility I can get off this medication or even lower the dose of the medication? So these are good questions to kind of have. Do I have to get regular lab tests based on this medication? Because some, you know, when you take a medication, it might help you with this, with something, the illness, but medications also have side effects, and they might, certain parts of our bodies need to be monitored because of that. Some medications may affect our liver, our kidneys, our blood. So doctors will say, you know, every 3 months you need to order a liver function test or certain tests. So, you know, if you know about it, then, you know, you're just more involved. So we should always be involved and ask these questions so you have a conversation going with your doctor. So those are some things you might want to ask. And also you might, you know, and this is for you, and if it's for some other elderly you're taking care of, if they cannot swallow tablets, if you have to crush tablets for them, or if you have to open the capsule and, you know, sprinkle it on their food or put it in a drink, there's certain medications that that have an abbreviation after them, and the abbreviation can look like SR, IR, ER, EC, or it could be, what's another one? I can't think of it. Yeah. Oh, actually it's CR. Okay. So if a medication has one of these after it, basically mean sustained release, immediate release, enteric-coated controlled release. Those medications should not be crushed, should not be opened, should be ingested the way it is intended to be ingested. So, and the reason is because they've been put into this delivery system so they can last all day. So some medications, instead of taking it 3 times a day, it might be in this delivery system, so you only have to take it once a day, and that's why it's sustained release. And so if somebody crushes it or breaks it, then that delivery system is broken, and then it could be dangerous because this medication might have a higher dose of the active ingredient, and so it could maybe cause, you know, certain too much of a drug effect. So be sure, you can even ask that for your doctor, from the doctor. Can this medication be crushed? Can it be halved? Sometimes people might take 30 milligrams of a medication, but they are given a 20 milligram, or they might be decreasing their dose from, like, say 40 to 30, but they only have 20 milligram tablets. So they'll be like, okay, I'll take a 20 and then I'll half a 20 to make it a 10. So you got to be careful about that if you can crush or cut a pill into half. Okay, so that's one thing I kind of wanted to bring up for sure. And also there's certain medications that could change the color of your urine. And so once you start that medication, there are certain antibiotics that can change your urine color to red or even orange. And that can be scary. Those are, I mean, you don't have to ask your doctor every time it's going to change the color of my urine, but if you see that happen, it could be possibly because of the medication. Just think and be like, oh, did I just start something new? Okay, and then you can always call the pharmacy, any pharmacy, not even, you know, if your pharmacy, for example, is closed and another 24-hour pharmacy is open and you're not sure about something, don't wait to talk to your doctor. Just call the pharmacy, because the pharmacist will know what to do. So you get that information. Okay, let's see. And also, you know, be sure, sometimes we have to go from one doctor to another doctor or a specialist. Always be sure that every doctor knows all the medications you're on because of drug interactions between medications. So you don't want to go, you might, you know, your primary care might prescribe 3 medications, and then you go to a specialist, they prescribe 2. But if that specialist doesn't know about the 3 that you're already on, and prescribes those two, which might be doing similar things as the other three, or one or two of the three, then there could be a possible drug interaction. Or maybe this medication is going to decrease the effect of the one of the others. So, and that's polypharmacy. That's where you can get, you know, effects that you don't want because of multiple medications. So there's a lot that can happen with medications. And so just being aware, having all these questions and thoughts in the toolkit that you keep with you is useful. Any questions so far? Yes.
Can you hear me?
I
Oh,
can.
yeah, you can hear me. One question I have is about the appearance of the pills. A lot of times they're not the same, and so you might get one that you normally take. It looks different. So I don't know if I should call the pharmacy when that happens, because usually you don't open your medication when you're in the pharmacy. You don't open it till you get home. So if it looks different, I'm not sure if it's the same pill, or do I just call back the pharmacy and ask them and tell them that?
That is an excellent question. So important. If you, like you said, nobody really checks their medication till they come home and it's time to take the medication, right? So, so that's a great question. I would definitely call the pharmacy back, because the pharmacy will then tell you, because they have a record of what, you know, they have something called the NDC number, which is part of the number that's on the actual bottle of the medication you got. So they can tell if the medication, the manufacturer changed the you know, the style, or, you know, the color or the shape, or if they're now getting it, you know, from another company, they'll be able to tell you. So that's very important. That's a very good question, because what if it is another medication? And sometimes you look at the medication, it might even have the strength written on it. Some do, some don't. It has a 20, or it could have like a 5. It just depends. But if you see like a 5 and you're supposed to be on a 10, or if you know, those are good things to notice. Very important. So yeah, definitely call back.
And one more question was about aspirin. I'm really allergic to aspirin. In fact, I started hemorrhaging one time when I was taking the low dose aspirin. So I was wondering, some medications have aspirin in them. So how are you going to know if there's aspirin in a medication like, I think, Advil or Aleve, or some of the other over-the-counter medications, they have aspirin in them? How would you know that?
So you want to look at the active ingredient in there. And so aspirin, sometimes you'll see the generic, that's sometimes called salicylic acid. So, you know, once again, if you're at the pharmacy, take the bottle to the pharmacy, you know, to the actual pharmacy, and say, you know, I'm allergic to aspirin. Does this medication have aspirin in it? And if you are allergic and your pharmacy knows about it, then they have in there, you know, your allergies. So some pain medications are usually, are also a combination of either Tylenol attached with the, like, for example, codeine and Tylenol. That's a combination. Some medications will have like, same thing, but with aspirin. So those are a combo medication. And so you would probably be prescribed the hydrocodone with the Tylenol versus the aspirin. But if it's, that's usually a scheduled drug. So that would come through the pharmacy. And so they would have it, but it's always good to say, this doesn't have aspirin, does it? You just go ahead and ask. But that should be a flag on their computer. And if they catch that the doctor prescribed that and they're filling it, it's just a second step to verify if you know, and then they'll stop that, and then you'll be prescribed something else.
Okay, thank you.
Yeah, but as far as like over the counter, you just look for the active ingredient, salicylic acid. And then, like Aleve itself is naproxen, which is not aspirin, but it does cause stomach irritation.
Uh-huh.
And, it can also cause a little bit of blood thinning,
Yeah.
but not as much as aspirin. I mean, baby aspirin is used for people for the blood thinning effect. So it's pretty strong. Yeah. And that's enteric coated, by the way. Baby aspirin, most of it. It's if you check it, always says aspirin East or whatever, Bear EC. So yeah, so you can't break that into half. Okay, awesome. Any other questions so far? We're almost to the end, so. Yeah, okay, so yeah, let me just see if I covered everything. Prescriptions, that copays, generics. Yeah, I am done. That's what I had for you guys. So we can go ahead and continue to ask questions. If you have any like specific questions about your medications that you have in front of you, or any other questions, go ahead and ask. And one other thing I would like to bring up is when you're taking prescription medications, there can also be interactions with foods you're eating, and also possibly with supplements. So you also got to be careful, and not just thinking drug-drug interaction, but there can be drug-food interactions and supplement interactions. So you want to be careful and maybe discuss that with your physician or your nutritionist or your healthcare professional, because there's certain foods like grapefruit juice that has a certain enzyme in it, and it can block the metabolism of certain medications. And so, or it can increase. So basically you can have either, you can have different things happen just because you're having a certain food, or like people who are on blood thinners, the blood thinner Coumadin, warfarin, that's a very, it's more of an old blood thinner, but it is still used. And that is very sensitive to foods that are rich in vitamin K, because vitamin K is the vitamin that helps clotting the blood. And if you're taking a blood thinner and having like spinach or things that have a lot of K, it can decrease the effect of the Coumadin, which might be detrimental for somebody who just had a stroke, or who really needs to have their blood thinning effect. But that's not used as much, I believe, now, but I can't really say because I haven't worked in the hospital for a very long time. So but yeah, so just kind of keeping those things in mind too. I mean, Google is a good place to go, but then there's a lot of misinformation as well. So you got to be sure and sift through, and sometimes that becomes very confusing because there's just so much information out there. Then you're just like confused, like what's right and what's wrong. So yeah, so you just want to double check with a healthcare professional with that.
So is hydrocodone the same as Traumadoll?
No,
It's not the same.
no, it's not the same. Yeah. Traumadoll is different, but it is a pretty strong painkiller. And then, sometimes, and that is a scheduled prescription drug. And by scheduled, that's one of the things I didn't go over, but there are different medications that are more regulated than other medications. And usually the ones that are more regulated are the painkillers because they're more addictive and they can be abused. And so there are something called Schedule 2 drugs, Schedule 3, Schedule 4, and then they're the regular ones that, like the high blood pressure and all those that are not scheduled in those 3 categories. But and then for those scheduled drugs, you do have to show your driver's license, and in order to get it scanned by the pharmacy, and then they'll dispense it. So we won't dispense that without form of photo ID. And that's just for regulation and just that we know that it's not being abused by the person, because a lot of people go to different pharmacies and try to get, painkillers and stuff, or Adderall and a lot of the ADD medications and stuff. So yeah, but going back to Tramadol, it's different than the hydrocodone. Yeah.
And it's stronger, or it's less strong?
Hydrocodone is more stronger.
Yeah.
And Tramadol is less. And however, there is a possibility of getting dependent on it. So, and then by that, basically what it means that you might be okay on that dose, but then you might need to increase it to see the effects, and then your body gets used to that dose, and then you might have to increase that. So it's usually a good idea, if possible, try to have some washout periods, or try not to take it every day. If if it's been prescribed as needed. A lot of times medications will say if necessary or as needed. And the reason is because you might not need it. And so if you don't need to take it all the time, I would recommend, especially those kind of medications, to stop, so your body can just kind of not get, dependent on those medications. Yeah. Okay. Any other questions? So today is a great day to kind of take out those journals, write down what you're on, where you are right now from January all the way till yesterday. That was the first half of the year. And if you're at the same place, that's okay. But we still have 6 months, half the year left. So that's a huge amount of time where we can make an impact on our bodies. People usually overestimate what they can do in a day, but they underestimate what they can do over a good chunk of time. So 6 months is a really good amount of time to where you could make a difference in your health, and small steps, but make that commitment to yourself. Don't overwhelm yourself, but really just write everything down. And it's really, really good to kind of just track yourself just for your own, your own progress, and see if you're drinking that water. Whenever you take medication, please drink it with water. I've seen family members who take it down with their tea.
Right.
or with their, with juice, which is, why are you taking your diabetes medication with orange juice?
Yeah.
Not gonna help. So try to have it with a full glass of water. You want that pill to go down as far as possible where it can do its job, and has enough, liquid to where it's not stuck while it goes down your throat. I usually like to tell people to first have a couple sips of water before you swallow your pills, because sometimes our throats are dry and it could get stuck. So have a little bit of water and then take your medication.
Sophia, I have one more question. When you're traveling and you have insulin in the pen, quick pen, it's supposed to be cool or cold. So suppose you're traveling long distance. Do you have to keep it that cool? Do you have to keep it in a cooler?
So some insulins do have to be kept refrigerated and at a certain temperature. I would take like a small cooler, or even, a cooler. And do you usually put an ice pack in there? Because that could be a little bit too cold.
I've only taken it in a thermos.
Oh, okay, that's smart. Yeah, I would, maybe an hour or two, but long distance, it does need to stay a little bit colder. Now I'm not 100% sure about the insulin as to how long it could stay at a certain temperature and still be okay. Sometimes the insulin can be at room temperature, but then has to be used within X amount of, hours, and it'll be okay. But yeah, but the refrigerated should stay cool.
Oh, okay.
Yeah. But I haven't really gotten that question, and so I don't want to say yes or no as to it can be or cannot be. I would double check with the and see if it can or cannot. But yeah, that's important to remember to take your medication and keep it close to you, especially if you have heart medication that you have to put underneath your tongue. That's the one that helps with the the heart attacks. And you can take, I think, up to 3 within a minute or so.
Really?
Yeah, nitroglycerin. So, but yeah, so always keep your medication. If you're diabetic, you don't want to go to hypoglycemia. So maybe keep a little sugar packet with you, just so that if you feel you're going into hypoglycemia, you can, kind of take that really quick. And yeah, just, think about all these things when it comes to medication and ways that maybe possibly you can get off of it. I know a lot of times once you're on these, it's probably lifelong unless the doctor says, okay, I'll give you 3 to 6 months, do your health, and then they'll say, okay, now you have to go on the medication, and now it might be lifelong. But there are a lot of times people get off of it. I know some people in here who've gotten off their medications.
That's good. Yeah.
Yeah. So yeah. All right. Any other questions? Okay. All right. Well,
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.